Okay, well, welcome and good morning, everyone. Welcome to the Dominican Retirement Association Medicare Transition webinar. We hope to enlighten you and answer lots of questions, shed a lot of light regarding this transition in your life here, where you're going from the non-Medicare into the Medicare zone. Okay, so hopefully you'll all be able to answer. There's a lot of material that's going to answer a lot of questions. So let's see if we can get through them, and definitely let us know if there's anything that you need for us to clarify. Okay. All right. So Mike already did the introductions. We will go over the Medicare, uh, today, Sarah, and also the Sarah Medicare mandate. Okay, the Medicare, how it works, Medicare plan options, and then of course we'll be here for questions if you have any. And also with me today attending, and you'll probably you get a chance to speak with her, sometime during the webinar, is I also have Yolanda Smith. She is also very knowledgeable, extremely knowledgeable, more so than I, in regards to the Medicare. And she is one of our managers from Kaiser, and she'll be able to help shed any light if there's anything that I can't um, explain more clearly.
And Yolanda, I made it so that you can talk whenever you like. So whenever you're ready, just go ahead and unmute yourself.
Okay, so with that said, who is eligible for Medicare and who is involved? Okay, so it's people 65 or older, under 65 if they have a disability, okay, and people any age with ESRD or Lou Gehrig's disease. Basically, Social Security Administration, and of course, the Center for Medicare and Medicaid Services, also known as CMS. So you may see SSA or CMS quite a bit. Those are the acronyms for those two organizations. Okay. Okay. So now, currently, if you're currently receiving your Social Security check, as you turn 65, they say that it's basically an automatic enrollment. They automatically enroll you into Medicare, and they go ahead and mail you your Medicare card. Okay. So if you're not collecting Social Security yet, and you're going to be waiting till later at a higher age to make it a larger Social Security benefit, then, and you're turning 65, you do want to reach out to Social Security and start the process. You want to let them know, hey, I'm turning 65, and I want to go ahead and get my Medicare A and B, so that they can go ahead and start that process for you. Okay. So otherwise, if you're collecting a Social Security check already, it's pretty much an automatic enrollment, and they'll go ahead and send you your Medicare card. I do, however, kind of recommend that, as you're approaching your 65th birthday, even if you're collecting a Social Security check, I would still give them a call just to check in with them to make sure they have all your current information. Okay. And then they'll say, oh, yes, we already got you going. It's in the process. You'll be receiving your card shortly, which is great. I always just want to make sure they have the current information. Okay. So Medicare Part B premium will be deducted from either your Social Security check, or they will direct bill you. Okay. So if you're collecting a Social Security check, they will automatically, deduct whatever premiums they have out of your Social Security check. Okay. Now, if you're not collecting Social Security check, then they're going to direct bill you, and they bill you quarterly. So they'll bill you for 3 months worth. Okay. And so you would need to go ahead and make sure you pay that premium to them so that they don't disenroll you from the Medicare. Okay. So your Medicare card basically gets automatically mailed to you if you are already collecting Social Security check. Now, some retirees or dependents who are disabled may be eligible for Medicare earlier than 65, which is a good thing. And once we get to the plan options and we start showing you prices, you can kind of see why it's a good thing, because the Medicare plans are much lower than the non-Medicare plans. And you'll be able to see how you can save some money if you have a dependent, or if you are under 65 and able to go ahead and get your Medicare at that time. Okay. Again, if you're not collecting Social Security check, you want to make sure you check in with them at least 90 days prior to your 65th birthday. Okay. There is a window, and I'm going to get to a slide that talks about that window, but you want to contact Social Security Administration, okay, and inquire with them as far as enrollment into Medicare A and B. Okay. Or you can also go onto their website if you're tech savvy. Go into their website right there, Medicare.gov, and enroll in the Medicare's A and B. Okay. screen. Okay. So Sarah's Medicare mandate. Okay. So when you or your dependent become eligible for Medicare, okay, which is typically at age 65, in order to continue enrollment in on our plan, you must transition over. The Medicare enrollee must transition over to a Medicare plan. You're not allowed to stay on the non-Medicare plan because now you're eligible for Medicare, so you need to transition over. Okay, so this mandate also applies for retirees who are receiving a monthly medical allowance. So if you're, a lot of people, they say, okay, I'm fine where I'm at. I got my Kaiser HMO, and I don't have to worry about nothing. This I don't want them. You need to go ahead and transition over and get your Medicare and transition over to a Medicare plan. And I'm going to show you why in the next few slides, how you can say it's going to save you money, but it also it keeps the Sarah from having to pay there's like a penalty fee in regards to someone who's Medicare and not enrolled in a Medicare plan. Okay, so currently the carrier offers that the Sarah offers, we offer Kaiser Permanente. Okay, so if you are in Kaiser or you're not on our United Healthcare plan and you get Medicare, you can go over to the Senior Advantage plan with Kaiser, or if you don't want to go into Kaiser, you can reach out and contact via benefits, okay, and they can get you enrolled into an individual Medicare plan that's nationwide. Okay, they are nationwide, and through that's where you would have your HRA account created. Now I'll be explaining that, and again, it's coming up in a few slides. Okay, so here's how you can see how you can save some money. Okay, so and why the Medicare mandate is of value to you. In this example, we're going to use a member who has 17 years of service. They're turning 65 and Medicare eligible. They're currently on the Kaiser HMO. Okay, the premium rate $843.16. Their monthly medical allowance that they're eligible for with 15 to 19 years of service is $447.55. Okay, so on their retirement check, monthly benefit, they see the deduction of that Kaiser $843.16. Then on the other box, they see the non-taxable subsidies that we're paying in, which is $447.55, which leaves the net difference of the $395.61 as far as what's that plan is costing them every month. So their out of pocket is $395.61. That's the difference. And so that's what actually gets deducted out of their monthly benefit. Now, the same member becomes Medicare eligible, enrolls into Kaiser Senior Advantage plan. Okay, that current premium is $344.44. We're subsidizing $344.44. That means they have zero out of pocket every month out of their monthly benefit from Sarah. So basically, that $395.61 that's been coming out for them to have that HMO. Okay, they no longer have to have that deducted out anymore, because now the plan for Senior Advantage is only $344, and we're going to subsidize the $344 credit, which zeroes out. So that's $395.61 needs to stay in their bank account. Okay, it's not deducted from them anymore. So now you kind of see how, yes, becoming Medicare eligible and transitioning over can save you some money. Okay, $395.61 a month extra. Why not? That's not bad. You're able to keep in your own pocket. Okay. What is Medicare Part A? Okay, when you become eligible for and enroll in Medicare, Part A provides hospital insurance. Okay, so they help to pay for hospital stays, skilled nursing facilities, rehabilitation, not long-term care, hospice care, things like blood, hospital care for qualified medical providers. You typically do not pay a premium for Part A coverage of Medicare if you paid Medicare taxes while you were working. There are some members who may not have paid into the system while they were working, and so they may be informed when they go to apply that there is a premium that they have to pay for Part A. Okay, well, we're going to touch base on that in a few slides, and we'll be explaining about that. Next slide. Okay. So enrolling in Medicare Part A, okay, for the majority of Medicare Part A costs nothing because you or your spouse or ex-spouse, if you're married for 10 years, paid Medicare taxes while you were, and you completed the quarters, okay? So 40 plus quarters, basically Part A is free, okay? And then of course, if you didn't complete the quarters, as you can see, there's a slight premium all the way to not paying it at all, where they're trying to say that, okay, for you to have the A, it's $499 a month. Okay, so for 2022, you may pay up to $499 to buy Part A if you don't get the Part A free. Okay, if when you go to enroll and they inform you that you have to pay this premium for the Part A, okay, you want to contact a Sarah. Okay, because you don't want to have to pay that. So you want to go ahead and give us a call and talk to one of our agents here, and we can kind of explain what we need to do. Okay. In most cases, if you choose to buy Part A, you must also have Part B. Okay. There is a monthly premium for Part B. Everybody pays a premium for Medicare Part B, and there is a late enrollment penalty. Okay. So you want to make sure that you're enrolling or trying to get enrolled with Medicare for your benefits prior to turning 65. That way you can get the process going. Okay, as long as you get your Medicare in, they won't charge you a late fee. There's a window, and I'll be talking about that in the next few slides. There's a 7-month window that you want to make sure you stay within, so you don't have to pay a late enrollment penalty. Okay, but you may have to pay a higher premium for twice the number of whether it's months or years that you could have had you signed up timely. Okay, and so no one wants to pay a late fee. Okay. So what is Medicare Part B? Oh, that provides the medical part. Okay, it pays for Medicare approved doctor services, outpatient, certain all kinds of care services, diagnostic tests, and several other services that Part A wouldn't cover. Everybody pays a premium for the Part B. Now, how much that is? Well, that would depend upon what you earn and what you supply to your taxes on your IRS, and I'll explain that in just a moment. So for most Medicare eligible individuals, the monthly premium in 2022 was $170.10. Okay, that's the lowest standard monthly Medicare Part B premium amount. Okay. Some members will pay more, and then, again, it's dependent upon your income, and this premium is usually deducted from your Social Security check. Otherwise, they bill you quarterly. Okay, so they'll do a 2-year look back is what they do when they're looking to set what your premium is going to be. Is it the next slide, Mike? Can you take a look? This one, how to enroll. Okay, I know the slide's coming up, but this is basically you can do it online. You can call Social Security. You can visit your Social Security office. If you do decide to go to the Social Security office, because I do believe they're open again, you want to try to make an appointment. Members have notified us to let us know that if they've made an appointment, the wait is very short, just a few minutes, and they're in talking face to face to someone who can assist them to help get enrolled. If you just happen to walk in, then some experiences have been similar to DMV. You walk in the DMV, you're going to be there for a while, so make sure you have a good book if you're just going to walk in and not have an appointment. Okay. Again, you want to check in with Social Security. You can check with your most local office, and they should be able to assist you to get enrolled. Okay, and see where your eligibility is. Okay, so this is the window period that I was speaking of. Okay, so it's critical that you take care of this within the 7-month window. So basically, it's 3 months before your 65th birthday. Okay, and mind you, your Medicare is always effective the first of the month in which you turn 65, unless you were born on the first of that month. If your birthday falls on the first of the month, then Medicare becomes eligible, or should I say effective, the first of the month prior. Okay, but otherwise, regardless of what day of the month you become 65, Medicare becomes effective the first of the month in which you turn 65. Okay, so if you think about your birth month, and 3 months before, that's when the window starts. And it's your birth month, and 3 months after, that's when the cutoff is to where you will get penalized if you don't select, enrollment. Okay, so you want to be real cautious about that. That's why we're trying to get you early so you can get the ball rolling. Okay, because again, the sooner when you turn 65, the month you turn 65, you're eligible for the Medicare to start paying the lower premiums. So if you look back about that screen that I showed you where the person became eligible and then they transitioned over and they started saving that $395, I'd want to start saving the $395 and keep it in my pocket as soon as I'm eligible for it. I don't want to wait to that third 3 months after I turn 65 and then say, okay, well, I've given away enough $395. Now I'll go ahead and I'll start saving that. No, you want to try and get this all taken care of. That way you can start saving that money as soon as possible to keep that in your pocket. Okay. Again, Social Security's enrollment period. If you miss your initial enrollment period and you go to enroll, it's January through March of every year. They have, for the enrollment for if anyone who missed their time window. However, the coverage won't become effective until July 1st of that year. So if you missed your window, okay, in January through March, you go ahead and go to enroll, they'll go ahead and they'll grant it to you, but they're not going to make it effective until July. And so what does that mean? That means if you think back about that $395, you're going to keep paying that $395 out of pocket until it finally happens in July, where it becomes effective. So that's why you want to try and be timely as far as getting your Medicare and also enrolling into a plan. Okay. Again, there is a lifetime penalty. It's a 10% penalty. Okay, so you don't want to pay a higher premium than you really can't need to. So you want to make sure you try and get everything enrolled and cleared up as soon as possible. Okay. Of course, the exception, the working aged, you can delay your enrollment into the Medicare until you actually retire. And basically what that is, for example, because we do have some members who are still working and they're turning 65 and they're on an employer plan. Okay, so they're not necessarily on a SARAS plan, but they also may have a plan through their employer. Okay, so they can waive the Medicare enrollment until they finally stop working and come off that employer plan. Okay, I'll explain that a little bit more in another slide. But basically, that allows you to not have to start paying the Medicare premiums until you finally actually enroll into it when you come off the employer plan. Okay, because you have credible coverage, and that's what they're looking at as far as an employer's coverage is a credible coverage. So Medicare is going to say, okay, that's fine. We won't charge you, and we won't enroll you until you come off that plan. Okay, so you got to be real cautious about that. Slide. Okay, so employer plans. Okay, so basically you can delay your enrollment into the Medicare and just use your employer's plan. Okay, and then enroll in parts A and B, have both Medicare and your employer plan. There's not likely any kind of benefit for that because Medicare sees that you're on an employer plan, and what are they going to do? They're going to say, okay, well, thank you for paying us a monthly premium for your Medicare, but we're not going to pay for these services because your employer plan is primary, so they need to pay this bill. So basically, you'll be giving them money for nada, right? Because they're going to push that the employer plan is primary. Okay. Or you can reject your employer plan. It's not a good idea. Okay, and enroll in Medicare and then supplement in other ways. That's not the wisest choice to do. Okay, so of course you'd want to, if you are working and you're on an employer plan, you want to make sure that you just contact Social Security. Okay, I'm still on my employer's plan. Okay, I'm not going to need my Medicare right now until I finally stop working, come off the plan. That way you don't have to worry about having to pay Medicare premiums until you finally come off the employer plan. Okay. All right. So remember I told you that they calculate out what your premium is going to be based on your tax return. Okay, and they do a 2-year look back. Okay, so here, let's try and adjust this a second. Okay, That's much better. Okay, so they do a 2-year look back. So right now in 2022, they're looking at your 2020 tax return. Okay, so let's take a look at the first one. The first column to the far left, file individual tax return, $91,000 or less. Okay, so if you filed your income tax in 2020 individual and you reported $91,000 or less, if you scroll to the right, you see your monthly Medicare Part B premium is $170, $170.10. Okay, if you file joint and it's 182,000 or less, your Medicare premium is going to be for the Part B is 170.10. Okay, let's go down. Let's take a look at the third one, the third row. Above the individual, above 114,000 up to 142,000, okay, for the year, okay, your Medicare Part B premium is going to be $340.20, $340.20. That's how they determine what they're going to charge you for your Medicare premium. Okay, so they do a 2-year look back. So that's what you want to keep in mind when you're trying to figure out, well, why are they trying to charge me this amount? Okay. Next slide. Now, the good thing is, you may say, well, why do I have to pay this 170? But then, well, the good thing is, ACERA, we have a Medicare Part B reimbursement plan. Okay, and you do not have to be enrolled in an ACERA plan to qualify for this benefit. Basically, what this is, and we take this to the board every year, okay, and the board votes that yes, we can go ahead and pay this amount. So once we find out what the new premium is going to be for the base amounts for Medicare for the new year, we take it to the board approves it and say, okay, yeah, it's okay for you to go ahead and pay that. So basically, you're paying for your Medicare Part B premium. Let's say they say that they're telling you 170.10 is what they're going to charge you, that you have to pay that, right? Okay, so yes, you pay that to Medicare, that 170.10. But in your retirement check here at ACERA, as long as you complete the Medicare Part B reimbursement form and provide us a copy of your Medicare card that shows that you have Part B, okay, in your retirement monthly benefit check, if you ever look at your statement, you see you have your base amount and then you have your cost of living. Well, you'll see a new line that says Medicare Part B reimbursement plan, and you'll see us giving you a credit of that 170.10. So Social Security and Medicare is taking it out of your one pocket here, but here at ACERA, we're putting in 170.10 here in your pocket. So it zeroes out. Basically, they're taking it from you, but we're giving you that amount right back. Okay. Now you say, how do I get this? Okay. Well, it's a non-vested benefit that's not available for dependents. Okay. Nor is it reimburse, will it reimburse dependent costs? Okay, it's only for the retiree member. Okay, to qualify, you have to have at least 10 years of service, okay, or a service-connected disability, and you have to provide proof of enrollment in the Medicare Plan Part B, okay, and you have to remain enrolled in the Medicare Part B, okay. So complete the form, provide a temporary card showing us that you have to be, and we can go ahead and activate that benefit as soon as, accordingly. So to enroll in the Medicare Part B, again, we have to have everything. You have to have the form and the card. You can't just send us the form and forget to send us the card and expect that we're going to activate that benefit. You have to complete the whole process. You have to provide us the form and provide us the card. Once we have everything, then we can go ahead and start doing that reimbursement and activate that for you. Okay. It is not a retroactive benefit. Okay. Enrollment in this is not automatic. Okay. So you must, again, complete the form and provide us a copy of that card. And enrollment in an ACERA Medicare plan is not required. So if you are enrolled in a plan under another agency or through your spouse's plan or another employer's plan, that's fine. If you went through via benefits, that's fine. We just need you to provide us the form and a copy of your Medicare card, and that as long as you have the 10 plus years of service or a service-connected disability, we can activate this reimbursement and start granting you that Medicare reimbursement for that premium amount. Okay, and you only have to do this one time. Well, this is just do it now, that you're eligible for. We started, and it continues onward. And next year, when Medicare or Social Security decides, okay, we're going to increase this 170/10 up to, let's say, whatever it is that they increase it to. Let's say they increase it to 180. Okay, well, we take it to the board and we say, okay, the board, hey, the Medicare Social Security has increased the 170/10 up to whatever amount they're trying to charge, and we get the board to say, okay, yes, that's fine, go ahead and match that. And so we will automatically increase what we're reimbursing you every month to match that when the appropriate time comes the following year. So you don't have to keep reapplying for this item. Okay. All right. Next slide.
And we have a question.
Sure.
The question is, do you need the actual card or a copy of it?
Just a copy of the card.
And then can that be sent via email if it's a copy?
Yes, you can send it via email. And the good thing about it is that, I mean, for years, people talk, when you stop and think about identity theft, the Medicare card used to have it has your full name, okay, and it had your Social Security number with an alphabet letter at the end. Anybody that's stealing your mail, or if you happen to lose your wallet or your purse, whatever, they get that. Now they got your full name, okay. There's a place there where you're supposed to put your signature, and they got your Social Security number. So it's quite easy to steal someone's identity. But what they've done just recently is that they now no longer use the Social Security numbers, but they give you an ID number, an identification number, so no one can get your Social Security number, which is great. Okay, so but yes, you want to send us, you can send us just a copy. You don't have to send us the original card. We don't want the original card. Okay, so just a copy. If you want to scan it and email it in to us, Sarah, that's fine. Once you email that in, we'll go ahead and get that. The team will get that into your record, digital record here at Sarah, and it'll get assigned to one of our team members that processes that, and they can activate that benefit for you. Okay.
Great.
All right. Okay, here we go. Now, the other Medicare portion is Part D. Part D is the prescription part. Okay. Now, a vast majority of plans already have a prescription component to it. Similar, our Kaiser Senior Advantage plan has a pharmacy part to it. Okay. And so basically Part D is built in to that. Okay. So you do not have to apply for a individual prescription plan, to have the Part D. If you're transitioning over to our Kaiser Senior Advantage plan, you don't have to worry about Part D because the Kaiser Senior Advantage has a prescription component to it. Okay, so you don't have to worry about paying for a Part D plan. It's already built in. However, what Medicare and Social Security has done is this. So what they're doing now, or they've been doing it for several years now, is depending upon where you fall on your taxes, remember the tax return, they will charge you a certain premium. Okay. So for example, in this case here, if you look at file individual tax return, 91,000 or less, follow that across to the right, you see you pay each month in 2022, just your plan premium. You don't have to pay anything. You're just paying for your whatever medical plan you're signed up for. Now, if you are, let's say, level 2, above 191,000 up to 114,000, okay, or filing joint of 182,000 up to 228,000 a year is what you reported on your taxes. You scroll across to the right, you'll see $12.40 plus your plan premium. Okay, so they may go ahead and start charging you that amount. They'll send you, it's called an IRMA. Okay, it's an income-related monthly medical adjustment, should I say. So it's not that you're paying a premium to have the Part D. What you're paying is it's an adjustment that they charge you because, I don't know, this sounds ridiculous. You're making too much money, so we're going to charge you this extra fee. It's like a fee that they charge. Okay, so and you do have to go ahead and pay it. Because if you don't pay it, remember this is all one organization. If you don't pay this part, it gets reported to the other part, and then they disenroll you, and then all of a sudden you get disenrolled from the plan, because they will notify the plan that you're enrolled in to that you have been disenrolled, which will cause you to be disenrolled from the medical plan. Okay, so that's just starts a whole ball of wax snowballing out of control. So and we need to help you correct. Okay, so depending upon again, well, your income, they may charge you a lot more for that. Sarah does not have a reimbursement for this. We have the Medicare Part B reimbursement. Have Medicare, reimburses for the Part B. We don't have something like that set up for this right here. Okay, this is something that Social Security and Medicare has put in place. All right. Next slide. Okay, so the types of Medicare plans. Okay, there's two types of Medicare plans. You got your Medicare Advantage plans, okay, which those you have a primary physician, okay, and a specific medical group that you're going to, okay. If you wanted to go see a specialist, you have to go to your primary doctor and get a referral to go see a specialist, okay. Most Medicare Advantage plans have a prescription part component built into it, okay, and of course, copays may apply. I mean, there may be some plans out there that might not have a copay, but you want to be sure to pay attention as far as what the kind of plan you're actually signing up for. Okay, and then with those, you must reside within this plan service area. Medicare Advantage plans, they expect you to be residing within the service area of that plan. Okay, Medigap plans or supplemental plans, those you're not assigned to a medical group, and technically you might have a doctor that you like to go to, but that on the plan like that, that's not listed as your primary physician, okay, because your Medicare is primary under those plans. Okay, so under the Medigap supplemental plans, your Medicare is primary, and so Medicare, you can use your Medicare wherever you want to go nationwide. Okay, so the Medicare pays, and then whatever Medicare doesn't pay carries over to the plan, and the plan picks up the other portion. Okay, so you can go see any MD that accepts Medicare nationwide. Okay, I mean, if you're here in the Bay Area and the doctor you're seeing says, oh, you need to have this procedure done and this, and you're like, oh, wow, this and this. And you do some research and you see, oh, this nationwide specialist that does the best type of work on this is doing business in New York or Miami, whatever, and you want to have that world best person do it, you give them a call. Yes, they accept Medicare. Can you make an appointment? Fine. Then you can go ahead and go out there and get your services done by that person because they accept Medicare. It's nationwide. Okay. So you don't need a referral to go see a specialist. Any specialist nationwide that accepts Medicare, you can go to. Okay. Whereas under the Medicare Advantage plan, you can't just go to any specialist. You got to go to your primary physician and get a referral to go see a specialist. Okay. Again, and these are Medicare only, so they do not have a prescription component. So if you get into a Medigap plan or supplement plan, it does not have a prescription component. So you would also have to sign up for a prescription drug plan, Part D. Okay. Of course, copays / deductibles, they could vary. So some plans, it'll be the exact same plan as far as a Medigap supplement plan, but it may have a slightly different deductible, but the coverage is still the same. So you want to make sure you do a good comparison when you're looking at one of those. Okay, a lot of people go into those, especially if they travel a lot or if they're, as they call snowbirds, they're here for a few months. Oh, it's starting, winter's coming, I better go somewhere where it's warm, and they go somewhere else where it's warm for a few months. This plan goes wherever you go. It's nationwide. Okay, so a lot of members do sign up for one of those. Okay. Now, as far as the plans that we have, on the non-Medicare, we have Kaiser HMO, we have United Healthcare Signature Value HMO, and United Healthcare Signature Value Advantage HMO. For Medicare, we have Kaiser Senior Advantage. That's what we have. Okay. If you do not want to enroll in Kaiser Senior Advantage, then you would need to contact Via Benefits, and Via Benefits can get you enrolled into an individual Medicare plan. Notice I said individual Medicare plan. Those are not group plans. Those are individual plans. So when this transition happens and you decide to go to via benefits to get a plan over there, you will not see, like right now, how you see that you may see the deduction on your monthly benefit from Acera, your statement that shows the Kaiser deduction or the United Healthcare deduction. Okay? You won't see a deduction anymore in there because the via benefit plans are individual, they're not part of Acera. So we will not be deducting for that premium and then doing a subsidy credit towards that premium. And the via benefits plans are individual plans. Contact via benefits, they sign you up for a plan. You're responsible for paying that plan, the premium. That plan turns around and notifies via benefits, hey, we received the premium from this person in this amount, and then via benefits turns around and issues you your reimbursement from the health reimbursement account, which we will discuss in a little bit. All right, slide. Okay, Kaiser Senior Advantage. Okay, so again, this is a Medicare assignment plan. Okay, when you sign up for Medicare and you go into the Senior Advantage plan, you're telling Medicare, okay, Kaiser's where I'm going. That's where my doctors are. I'm going into the Senior Advantage plan. Medicare then gets assigned to Kaiser. Okay, so and it's good because you don't have to worry about any paperwork or all that stuff. You get your Kaiser card whenever you need to have services. You go into Kaiser, you show your Kaiser card, boom, boom, you get taken care of. You pay your little copay, and you're done. Kaiser's business office takes care of any claim forms or benefit items that they need to take care of with Medicare, so you don't have to worry about that. Okay. Again, our Kaiser is only in California. We no longer have the multi-site Kaisers in other states. Ours is only in California. Okay, and of course you'd have to reside within the service area to be able to be enrolled into that plan. For 2022, by yourself, it's $344.44. If you and your dependent are both Medicare eligible, then it's self plus one, $688.88. Okay, and there's also a family coverage plan. Now, under our Senior Advantage plan, your copay is only $10 for office visits. Okay, so and it's also $10 for the prescriptions. So, I believe it's a 100-day supply. Okay, now some medications, it may be. I've seen some members where they do the prescription, and the prescription is lower than the $10, and they tend to pay a little bit lower. They pay the lower cost, but otherwise they pay the $10. Very rare that there's a medication that is some kind of specialized medication that's out of the norm for a tier, and so they may say that you need to pay just slightly above the 10, but typically it's always $10 is what your copay is. Okay. Now I know it says they're new for 2022, the Silver and Fit gym membership. Okay, this year 2022 was the trial year. Okay, we did get with the carrier, and we did work with the board and so forth, and so we are going to continue the Silver and Fit gym membership with the Senior Advantage. It's not going to end this benefit year, so we are going to continue it into the new benefit year. So if you are looking to sign up for that, that's great. You can go ahead and do that once you're enrolled, and it is a benefit that's going to continue into the next benefit year. Okay. So again, you would be enrolled into the Medicare person would be enrolled into the Senior Advantage, and if you have a dependent and it's not Medicare, then they would stay on the HMO plan, and you would be on the Medicare plan. Okay, just so you know how that works.
Okay, there's a question. Question is, if I select Medicare Advantage now and later I move to another state, could I select a Medigap supplemental plan?
That is correct. Yeah. So if you happen to relocate, you enroll in our Senior Advantage plan, and you go and you relocate somewhere else out of California, somewhere else. Okay. Well, then you would need to contact via benefits to get enrolled to a Medicare plan in the area where you're now located, so they can get you into a Medicare plan and have coverage. And of course, we would get you disenrolled from the Senior Advantage plan here. Okay, and then you would just have the coverage through via benefits that's nationwide, wherever it is that you're happen to be residing now. Okay. Now, when enrolling, okay, now there are some members, typically it's safety members, because safety members, they don't pay in, or they may not have they may have been a safety member, and typically the safety members don't pay into the system. So if you're one of those members that didn't pay into the system, and they try and tell you, hey, you have to pay for Part A, okay, and you do want to be in Kaiser Senior Advantage, you're not looking at going anywhere. So what you can do is you can waive the Part A. Say, okay, I want the A. If I got to pay that $499, I don't want the A. I just want the B. You can just get your Part B Medicare, okay, and we can still get you enrolled into the Kaiser Senior Advantage plan. We have a Part B only plan with agreement with Kaiser at this time, and so we can get you enrolled into the Senior Advantage plan, so you can get into this nice low cost plan, okay, without having the A. The rest of you, you do want to get the A and the B, okay, because the A is typically free if you've done enough quarters, okay. Also, the other way you can always take a look when you talk to Social Security is that, if your spouse has, or your ex-spouse has paid into the system, they might be able to see that you qualify for it because of a spousal eligibility, okay. But there's a certain age that they have to be for you to be able to do that. So again, Social Security would be best to talk to you about that if you don't qualify for it on your own.
Great.
All right. Again, like I just mentioned briefly about the Silver and Fit. Okay. So again, it was a trial year this year, the first time we've been able to offer that. And we're going to go ahead and continue it into the next year. So it's going to be a good bet. It's a good benefit. You can choose to have, sign up for a gym. You can also choose to have a home fitness kit. You can just select both. You can say, yeah, I want to sign up and be able to go to a gym. But I also want the home kit just in case I'm not feeling well or it's raining and I don't want to go out to the gym. I want to work out here at the home. They can send you the kit so you can do your home workout kit too. So you can select both if you choose to do so. Okay. Again, there's thousands of digital workout videos, all kinds of stuff that you can do with that to help you keep in shape. Wellness, healthy. That's what we're looking for. We want you to stay well. Okay. So we're trying to do what we can to provide you all the tools and options for you to do that. Again, you can reach out, you can go online, or you can call the number and check in and see what gyms are in your area. If there's a specific gym you go to, you can always check in with them to see if they're actually a part of the Silver Fit. Okay, but they got quite a few gyms, several thousands that are out there. Okay?
And if they're not part of the Silver and Fit, there's a method for requesting that your gym be added.
Right, and then they can go ahead and talk to your gym and see if they're willing to go ahead and join and be part of the program.
And if you want more information on that, the website is acera.org/silverandfit, all spelled out.
Exactly. Okay, so via benefits and the Medicare plans. Okay, so plans through the Medicare exchange are not Acera group plans. Okay, they're individual plans and will not appear on your monthly statement from Acera. Okay, members and dependents are solely responsible for paying any premiums to those carriers to maintain that coverage. Okay, Acera is not going to pay that on your behalf like we do now. Okay, so if you are eligible for Medicare monthly medical allowance, you'll be granted a health reimbursement account. So anyone with 10 or more years of service or a service-connected disability are granted a health reimbursement account. And this only pays for your out-of-pocket medical expenses up to what you have as far as a balance. Okay. So, and this is only for the retired members. Okay. So your dependents are not eligible to get reimbursed for their out-of-pocket medical items. Only the retired member. Okay. Next slide. Let's see what. Okay, so basically, they don't have an office that you can walk into and so forth. Enrollment is done over the phone. Okay, so when you get ready to do this, you want to make sure you have all your prescriptions and things like that with you because they're going to ask you a bunch of questions so they can try to help find the best plan that's going to cover you and give you the best bang for your buck. Okay, so the carriers on the individual side, they do require both Medicare Part A and B. Okay, So you got to have your Medicare Part A and B to get enrolled into a plan on that side. Most Medicare Advantage plans have a Part D built into it. Again, Medigap and supplement plans are only medical, so you'll need to enroll in a prescription Part D plan. And the licensed benefit advisor that you'll speak to when you go to VIA Benefits to enroll into a plan, they'll go over all those items with you. And if you select the Medigap or supplement plan, they'll also try to get you the best prescription drug plan Part D for you, depending upon what your prescriptions are. Okay. Again, the plans are nationwide. Reimbursement available for retirees out-of-pocket medical expenses. That's for your medical stuff, prescription drug plans, your co-pays, any deductibles, and anything that's, as long as it's medical, you can submit for claim form to get reimbursed for that. You can set up auto pay and get direct deposit for that. So like your reimbursement, the VIA Benefits can direct deposit your reimbursement right back to your account. Okay, it's either that or they're going to mail you a hard check. And if you're, you're kind of leery about the post office, sometimes the delivery is kind of slow, or you may have people who are breaking into mailboxes and so forth. And you want to make sure that it's the safest way to get the money back is get it direct deposit. Okay, especially if it's depending upon where you are, with bad weather and some areas getting snowed in and so forth. That mailman might not be able to make it through the snow to get your stuff in your mailbox. So direct deposit's always a good way to go. That's also the fastest. Okay. So reimbursement for the current plan year must be claimed by this March 31st of the following year. So for example, someone was enrolled into a plan with VIA Benefits and they were getting their reimbursements year in 2021. Okay. So now we're in 2022. Let's say at the end of 2021, because you have a certain amount in your health reimbursement account, and then come January 1st, whatever balance you still have, if you haven't used it all, it's wiped out to zero, and now you start a brand new amount come January 1st for this new 2022 year. Okay, so let's say now you're in March, and you finally get the bill back from the doctor's office or whatever the case is. Say, oh, here's this thing that for services you had in 2021, and you paid that. Okay, so you have until March 31st to submit any claims for services that you had not gotten reclaimed for 2021. So if you still had a balance at the end of 2021, okay, and let's say you had some stuff in, like December, you forgot to submit the claim. Well, you got until March 31st of 2022 to submit against any balance that you still had in 2021, if you still had a balance, okay? Otherwise, it's all just zeroed out. So right now in 2022 is what we are. So if 2023 comes along, okay, and you still had a balance from your 2022, and you find, oh, I didn't submit for these 3 prescriptions or whatever the case is, and you want to submit that claim in, you got until March 31st of 2023 for anything that you had out of pocket in 2022. Okay, I hope that's kind of clear. It's kind of repeating myself, but I just want to make sure you kind of understand. You got until March 31st next year for anything that you did not get to submit in this year against your balance, if you still had a balance at the end of the year for this year. Okay.
And there's a question.
All right.
If the plan has prescriptions built in, do we still have to pay for Medicare Part D?
Well, you don't pay for Medicare Part D directly to Medicare. Okay. If you have, like I said, if your income's up at a certain level, if you remember that chart, that IRMA, okay, then they may bill you for the IRMA because as they say, you're making too much money, so you need to pay this extra amount to us directly. Okay, but that's something, that's the IRMA. That's nothing to do with the Part D prescription plan that is built into your plan itself. If you're on a Medicare Advantage plan, chances are prescription Part D is already built into it, so you're not paying anything extra. It's already part of your premium to have that plan. If you're enrolled in the Medigap or supplemental plan, then yes, you would be also having to pay for a prescription drug plan. which is Part D. Okay, so that's what you would pay. So you'd be basically paying your premium for Medicare, Medigap supplement plan, but then you're also paying for your prescription drug plan, which is a Part D. Okay, that's what the Medigap supplemental plans have. Okay. Hope that kind of clarified for you.
Okay.
Okay. Now, when you do contact via benefits to get into enrolled to a plan, like I remember I said you want to have all your prescriptions, and the reason being is via benefits they have what they have. It's called a prescription profiler, and what they do is when they're talking with you, you're going to let them know about what prescriptions you're on, what milligrams, and this, and they're going to key it into this prescription profiler. This profiler is going to search the prescription drug plans and basically pop up the best plans that are available. Okay, so like the top 5 or whatever it is. And so the benefits advisor will tell you, okay, hey, this plan X, covers all your medications, and this is what the premium would be for that, and this is what the co-pays are for those prescriptions. Okay, plan Y, covers most of your prescriptions at this cost copay, but this one prescription you have is going to cost this much more for a copay, and the premium is going to be this much. So they're going to provide you so that you can kind of see, okay, where your prescriptions may fall under these different prescription drug plans, and that way, and what the premiums are. That way you can select, okay, well, yeah, I think I'll take X over Y. You'll be able to make that decision. Okay, so they're going to help you out on finding that out. Once members have enrolled into a Medicare plan through via benefits, they pretty much stay where they are, unless something really awkward happens, like they relocate or something's going on. The only thing that the majority of retirees do, and we encourage this to do, is around mid-October, we let them know you should actually contact via benefits and have them check your prescription drug plan again. Okay, because as you know, these pharmaceutical companies are always creating new medications, and medications are always changing tiers. Okay, and so the prices change. So if you reach out to via benefits and you check in with them, let's say next year, you chose plan X this year, right? Next year you check in with them. Okay, these are my prescriptions that I'm on, this and this. They run into, okay, hey, okay, you're on plan X that has this copay, this premium. The plan M right now, this prescription drug plan is your prescriptions are going to be a little bit lower in cost on copays, and the premium is a little bit lower. Well, and that's a no-brainer. Okay, well, if that's the case, if I could save money by going to that plan, then go ahead and let's switch my prescription drug plan. So it's always good to check. Sometimes they'll say, well, no, your plan X is still that you're on is still the best coverage for your prescriptions according to what's being seen for the other prescription drug plans. And then okay, well, I'll stay with the plan X then. I won't have to switch over to another prescription plan to try to save any money. So, but it's always good to check, because like I said, big pharma is always creating brand new medications. Prescriptions are changing tiers, copays are changing on those. So it's always good to check in and see if there's any way you can save a little bit of money every here and there. Okay. Okay. Again, open enrollment. Okay. As you know, open enrollment's coming up. In October, you should be receiving around the beginning of October, possibly towards the beginning of the second week. You'll probably be getting our open enrollment packet that comes out to all the retirees. Okay, and so in there you'll have our guidebook, new information, everything like that. So for via benefits, because it's on the individual side, the Medicare open enrollment and so forth begins October 15th. So they have October 15th through December 7th to make elections, and their plan year begins January 1st. Okay, so any change you do with via benefits during that open enrollment becomes effective January 1st. Now, Sarah's open enrollment is the entire month of November. Okay, and our plans become effective February 1st. So there's a little bit of a difference to us. You want to make sure you're keeping us informed as far as if you're on our Sarah plan and you're switching over to a VIA benefits plan, reach out and let us know, just so we can make sure that we're watching you to see that, okay, yeah, they're transitioning over to a VIA benefits plan, so that we need to stop the Sarah plan at the end of December, because come January, they're going to be on the VIA benefits plan. Okay? So we got to make sure we get all that taken care of. So again, medical, dental, vision plans, open enrollment's coming up. You'll see the new information in the retiree guide that's coming out. And currently, this is how it's looking. Okay, so currently the top with the non-Medicare is the top chart. Okay, in 2022, for 20 years or more, 2022, the MMA that we subsidize is $596.73. Okay, that's what we paid towards your Sarah plan if you have 20 plus years. If you're if you're a member that's already enrolled outside of the area and enrolled in the VIA benefits plan, then that $596.73 is what's going into the health reimbursement account for you to get reimbursed for your out-of-pocket items. Now that you're transitioning to Medicare, it goes down below. So the individual Medic plans through VIA benefits, 20 years or over, this year, $457.13 is what goes into their monthly HRA account. Okay, as you can see, 15 to 19, $342.85 and so forth. Now, one of the questions I always get is, well, why is it that when I was non-Medicare, I was getting the $596, and now that I'm Medicare, it got reduced down to $457? Well, the reason for that is the Medicare plans are extremely lower than the non-Medicare plans. Okay. For example, I have several members that contact me every so often, and there's some that are they're in other states and so forth. And like there's one she contacts me. She says, I only pay like $39 for a Medicare Advantage plan, and my copay is like $5 so a month. So there's no way she ever finishes up, even though she's down. I think she's a 15 to 19 years of service member. She's getting $342.85, but she never uses up all the money that's in her HRA account. A vast majority of members never, finish up all the money that's in their HRA account. Okay, so there's very few, and I think I can probably count them in like just like a handful. And those are typically members who are on specialized compound medications, okay, due to an ailment they have. And so those medications cost quite a bit of money. So those members, when they're having a situation like that, yeah, they'll tend to run out of their HRA account money, usually around November. They'll run out because their medications are so high. But the vast majority of members, they don't use up all the money that we put in to their health reimbursement account. Okay. And I do believe these amounts will be increasing for 2023. So we'll watch for that. Keep an eye out for your retiree guide, and you'll see the amounts that are coming. Next slide. Okay, so qualifying events. Qualifying events are a loss of coverage, okay, relocating out of the service area of your plan, annual open enrollment, becoming Medicare eligible, retiring after age 65, okay, marriage, and new domestic partner. So those are qualifying events, and that would allow you to go ahead and make a change to your plan. Okay. Okay, so, and this happens quite a bit. Once we activate a direct deposit for a retiree when they first retire, it's like all of a sudden, whoop, they drop off the radar. They're gone. We don't know where they are. But hey, the money's going into the account, and that's all that matters. Well, it's always good to let us know where you are, because there are times when we have to send you things. For example, the annual open enrollment period guide that we send out. There may be other important notices that we have to send to you. So if you are relocating, you want to make sure you contact us. I mean, it's just critical that you let us know and keep your address current with the SARA. Because who knows, you may have moved out of the service area of your medical plan. And then something happens and you go to have services and there's no plan. Well, we couldn't contact you because we didn't have your current address. So we couldn't reach you to tell you that, hey, you need, you got to switch plans. You don't have a plan. You're going to lose your plan. And so it's always critical that you let us know and keep your account with the SARA current with your current address and information. Okay. I really don't think we bother you too much. I think we reach out to retirees too much, but when we do, it's usually something important that you should be aware of. Okay. So again, you must complete an SARA address change form to update your record. Only a signed change form will be accepted. No phone calls or emails. You can't just say, hey, I relocated. This is my address. Just change it. You can't do that, and you can't just send an email say, hey, here's my new address. Just change it. It's gotta have your signature because remember, we're talking about your money here. It's a retirement, and you don't want somebody else pretending to be you, changing your information. So by calling us and telling us this or that. So, you want to make sure you sign the form and send it into us so that we can make sure that it is truly you. And so, yeah, we will make the changes to your account. Okay. Retirees who reside outside of California may not be required to pay California state taxes. So if you didn't relocate out of California, then you may want to also complete a state tax form to have us stop taking the taxes out for the state. Okay. Again, remember to send us an address complete form when your name changes, all that stuff. And all this is found on our website at www.sara.org/forms. And you can scroll down and you'll find the appropriate form. Just click it. A lot of our forms are now on DocuSign, so you can go in. You can go in and complete it and submit that in, or you can always download the PDF, manually fill it out, sign it, and go ahead and get that into us.